Assalamu alaikum, you're watching Healthwise and I'm Dr. Tahira Shayed. Our subcontinent is probably the only region in the world where right after the wedding, on the next morning itself, the girl is questioned as to if there is a good news. And the pressure starts continuing from there. Every day of her newly married life, when the husband and wife are supposed to actually enjoy, get to know each other, get to establish themselves, they are questioned repeatedly as to when a new child is coming. There's pressure from the family, and very soon, even when it's not even 6 months, and if they're not able to conceive, they are actually labeled as being barren or not being able to produce. And that is why we thought this social subject, this social pressure, this actual problem needs to be addressed. And that is why today in our studios we've invited two very distinguished guests, the very well-known IVF specialist and gynecologist, Dr. Salma Kafil. Thank you so much for joining us, as well as Dr. Rifat Bibi, who's an embryologist. And this subject is very important because in our country, which is actually burgeoning with, population, so many children getting born every day, and we have, that is such a big issue, there is a very big issue with infertility as well, because all these couples who are actually struggling for a child are not accepted by anybody. The woman is called barren and shunned and even abandoned, and the man is actually called a no man for that instance. So that is why we will discuss this subject in detail and learn about IVF and the options all these people have. Thank you so much, ma'am, for joining us. So first things first, what would you actually describe as infertility? Because over here, even one day is enough to label somebody as infertile. So who is an infertile person?
Okay, fine. Actually, when a couple gets married, so up to 1 year is taken as not subfertility, so it takes that long time. But if couple is little older than 1 year, we start investigating them a little earlier. But young couple married only for 1 year, they are have a physical checkup, making sure there is nothing significantly wrong. So then we just reassure them and say, keep trying, inshallah, you will get pregnant. And if they don't get pregnant after 1 year, so mean that is time now we go a little further, more advanced investigations, making sure where the problem is. So this is the duration which we wait. And when older couple comes, so it means we should investigate them early because they have many other
problems. So how important is it to investigate both the parents, like for example the boy and the girl, because here it's believed it's the woman's fault, and the woman is labeled as not being able to produce a child, and she's given all sorts of hormones and treatments even without investigating the male. So could you please tell our audience that it is both these partners that are required to contribute to actually produce a child?
Okay, so there was time when this was very much established, and most of the, especially the family from male side, they thought nothing can go wrong with the,
with our boy.
So most of the time the girls were presented for fertility investigations, and she goes through so many, psychological, physical torture, and without investigating the male partner, which was the saddest thing of all. Now, since we have gone through a very advanced fertility studies and protocols, you'll be surprised to hear that we investigate the male partner first. It's easy. Why we do that? Number one, it's very easy, it's not expensive, and he has to produce only the specimen which kind of answers a lot of questions. So if that is not, if that is okay, then we start talking to the wife that she should be investigated, and that's after roughly. But nowadays, I must say, couple are so anxious. They will come after 2 months, after 5 months, after 4 months, and I keep looking at their faces that this is not the time to go through this.
Exactly. And what role does this anxiety play? If you have also so much of pressure on you, I think that is one reason why they're not able to have a baby, right? Because they have so much of pressure. It should remain a normal, pleasurable experience.
Exactly. And this is one of those things which always I say that please don't stress them बच्चे आ जाते हैं जब एक अल्लाह का हुक्म होता है उस वक्त आते हैं.
Nature take its course and
enjoy.
let give them the time that is needed.
So that is the thing which family has to understand, the couple has to understand, in making sure that they shouldn't be stressed and they should not put through very expensive investigations to start with.
Okay, when we talk about what could be wrong with either partner, for example, if we come to males first, and it could start with impotence, and then it could be actually some kind of retrograde ejaculation, or then there's all those oligospermia, azoospermia, and all that. So when you talk about all these, how many of these are reversible, and which of these are not reversible, and can they actually be helped with IVF? And does it actually, you know, make it okay, fine, they're not able to produce a child, but does it in any way establish that they're not, you know, complete males as in our society, and just based on hormones or some kind of test, they, you know, totally brand them as being non-male, and then they suffer from all that torture and make the other person, you know, suffer abuse as well.
True. In fact, many males think they are not infertile.
Yeah.
Because they think if they can perform, then it means there is no subfertility, no problem.
Yeah.
Basically, there are two things. This is function, and that is a kind of semen is the one which is produced. It is a source to produce and place in a place where it should be. So when we test the semen, so it means that semen's number one, the volume, the numbers, the quality of the sperms, their motility, their a lot of things, are they normal, abnormal. And you will be surprised that in all previous years when initially we started, so we used to think that it's very few males are you know, fertile. But now I think the ratio in percentage has increased. We used to think it's about 10 or 15%, but I think it's now I think I can
to 50%.
And what could be the
really
what do you attribute? All this illicit drug abuse, radiation, as well as these anabolic steroids that they are taking?
When they ask me question why, it's multifactorial thing. Number one, now society is very open and with no protocols, Sharia or social.
Exactly.
So that is one of the most important thing, that if you are not strictly with your partner, so you may catch diseases. And you must have heard the sexually transmitted diseases. Now, so many cases we see and we get shocked. Now, how we should tell them where it has come from?
Exactly.
Apart from that, other infections are also common. And all those infections, they cause damage to the sperms, and they become kind of abnormal, sluggish. Lot of abnormalities with sperms have with this kind of attitude. So after that is radiation is not that common if somebody has, so it's just few cases, you know. But so most of
it is the infection, the STDs.
It's the infection.
So everybody out there needs to know that, you know, they keep fearing that polio drops might make them infertile, whereas the actual thing that makes them infertile are these bad habits.
Habits. Right? It's the bad habits. I will come to that as well, because we have been observing this city. I have been long time, so we can talk about that. But basically, it's the infection, and it's their habits which are not, you know, according to the protocols. So that should be avoided, and it's a hygiene. If you don't have a hygiene, proper hygiene, then again you get infections, fungus, so many things. Then it's the like bad habits, smoking also, addiction, smoking, drink. So they all interfere with the fertility.
So when we talk about hygiene, we're probably the only religion that stresses on taharat. We are supposed to wash after using the washroom. And why don't we do it? Like, why don't we do it the proper way? Why don't we attach importance to ghusl and wuzu when we talk about all of this?
And religiously, this is one of the most, you know, basic protocol, that you must wash.
must wash, and you must also change your underwear daily and make sure about that hygiene. Now, coming to the female part of it, the reasons of female infertility, the hormonal issues, the structural issue, the PCOD, the PID, what would you say? What are all the different reasons?
Female, again, if we start again, infection is one of the most common thing what happens. Unfortunately, in our country, as we don't have very much organized fertility centers which observe the proper protocols of fertility, and as a result what happens that they don't know proper hygiene. Even in their monthly periods they may use anything
and
which is
then they have this belief, this myth that they shouldn't be taking a shower during the entire period, which is completely wrong. So can you please tell them, as a gynecologist, please, during your monthly cycle it is totally normal, rather advisable more to take a shower, and it's not going to cause you harm but actually do you good.
Exactly. So it's a personal hygiene in all respect, menses, otherwise relations. Apart from that, which comes like in the systems or body or genetically. So one of the most common problem currently is the polycystic ovaries.
PCOD.
PCOS. So this is in fact a condition where the ovaries have lot of eggs in both ovaries, but they stay on a very small size. And they do not respond to the hormones, where in the natural hormones, or in even if you giving them help with the injections or so, so they don't respond properly. As a result, they, if even they produce some eggs, they are not that good quality eggs. So this is one of those things, and this delays the periods of the girl, and they grow fat,
and they have acne and hair loss, and we keep getting a lot of those cases all the time.
So mean that she needs help. Now here it is a medical help is required. So we investigate, we make sure it's a proper polycystic ovaries. Nowadays that's another problem. Every girl goes to a GP, they say, you have a PCOS, so they put them on all kind of medicines. I think she has to be investigated properly, and then she should be given proper treatment for that particular duration which is required. Then re-evaluate and make sure, and it works. They go lose their weight, the ovaries reducing.
So coming to IVF, Dr. Rifat, let me come to you now. Talking about IVF, what exactly is in vitro fertilization? What was that first test tube baby? All these couples who are willing to have a child, how do they go about it? What do you do in it?
Basically, after this stimulation, ovaries stimulated with the hormones, then the gynecologist do the egg retrieval, and we in the lab, we identify under the microscope each aspirate and identify the egg. And after the egg identification, then we get the husband sample and properly evaluate that one. And depending upon the quality of sperms, we plan either IVF, in vitro fertilization, in which we put the egg and the sperm in the dish and they fertilize on their own. It's more close to the natural process. And if there is some problem, and if the duration of marriage is longer, then we normally put them through ICSI. It's intracytoplasmic sperm insemination. And in this procedure, we select one good sperm under the highest resolution of the microscope, and then we put it inside, inject it inside the egg
to make sure that. For this, what age limit is there for this?
For the female, if she is producing egg, so she can try. But if we say over 40, its chances are low. It's roughly 5%. So better if you are under 35 and you are trying for the pregnancy. So it's better to step forward for this procedure rather to wait and delay your fertility and that fertile period.
And what is the percentage of its failure? Are there chances of failure? Because a lot of people get very, very apprehensive in terms of the expense involved, and then putting their bodies through this, putting their minds through this. So should they be prepared for a failure in case there is any?
Because it's not 100%. Because sometimes a patient thinks that we are putting the money and we will get the whatever what we are desiring. So it's not like this. But it's a procedure, it's a help that we are giving to the couples, and they must understand that there are multiple factors. It's not just the fertilization. So there may be something that are
incontinence as well.
Maybe the DNA damage in sperms. Maybe they are healthy looking, but maybe they are not in a good DNA
so is
content.
the baby healthy? The baby born out of these procedures?
After the procedure, the babies are normal, healthy, and they are perfectly fine.
We see a lot of multiple babies with such procedures. Is that normal as well?
We normally put back 2 good blastocyst or day 3 embryos. So there is a possibility of twins.
There is a possibility.
Yeah.
So coming to you, Dr. Salma, what about gender selection? Do you get a lot of gender selection requests over here? Because this is another problem, that they have to, you know, have a male.
Yes,
and sometimes
yes.
they have a lot of daughters, and then the pressure is that if you don't have a boy, you're going to get, you know, divorced or whatsoever. So do they come to you for that as well?
Yeah, a lot of people come in for many years. We started actually going back to, I think, 90s. So when there was a method we call segregation, so it means that sperms, you segregate the male and female, and which was nearly 85% segregation, not 100%. So people still wanted to come, you know, and we had, alhamdulillah, with this procedure we had quite a few numbers of male, and there are 10 to 15% female. And we always used to tell them that it's going to be female as well. So don't, you know, get upset when you have a female.
So in our society, where people end their marriages because they're not able to have a child or not able to have a male child, and, you know, all these pressures, there's no concept of adoption of all the orphans around, and we have to have our child to prove that we are normal. So what would you tell all these, you know, couples, all these young couples? What would be your advice to them, and what are the options available to them? Just a brief note to our viewers before we can leave.
If I go to gender selection, there is another technique we call PGD, and that is done through the IVF, and then that embryo gets tested, that is male or female, and then that embryo gets biopsied, making sure it's a boy, and then it's transferred in the uterus. Okay, so they have, that's a kind of, if pregnancy takes place, it means it's a sure method of having a boy, but it's expensive as well, because it involves a lot of very advanced technology.
But isn't that intervention in nature? Wouldn't that be spoiling the balance of, you know, the
But we are
no,
practicing it
making
for
it
family
easier.
balancing, not
It's
for
for
gender
family.
Not
selection.
for the gender, yeah.
and we basically making it things easier for the family, so that
For the
they're, you know,
family.
so that there's
Now,
structure
if you
stays
see,
intact.
it cannot imbalance because nature is so big. So it's just
Yes.
few.
We are a very fertile nation anyway.
17% of those couple who come, so they all don't come for the gender, they come for fertility. It's few couple, again same as in our society, so people, if they have more money, so they want to have more boys and so on. And this
Coming
goes.
to infertility, could you tell our viewers one more thing? They're very much fond of improving performance, and as a result, you see every wall in our country covered with these kind of ads, which is, you know, promoting male performance and all things like that. Could you tell them the realistic things are very different from what is actually shown on different platforms, and their approach should be more realistic, and they shouldn't be harming themselves with all these supplements instead?
I think that's a very sad thing.
Yeah.
And very sad, because when we watch the programs where the fertility is being treated in the mud and in the dirty waters and so many things, so I think I always admire Allah's, you know, the beauty in nature, that how beautiful He has made those systems. And this in fact requires to go through an investigation, making sure that where the problem is. There are three basic things which we look for. Number one, as I said, that we test the male first and then go to the female. Secondly, female, now making sure that she produces egg every month. She has enough kind of hormonal system which makes egg. Thirdly, that her tubes are not blocked.
Okay.
So if we have those three things, then treatment is much easier. What you're going to do, how you're going to do, and that's not that expensive either, you know. Medicines are very expensive nowadays, which patient really feels, but they don't mind. So one has to avoid all those things, going to these traditional
taking
kind
all
of
those traditional
taking
mixtures and
mixture
tinctures that are
and,
laden with steroids and mercury.
The worst thing which I think is when somebody gives them to use something internally, and that is the one which makes most of the women infertile, by putting unhygienic, dirty chemicals, things, and which ruins them forever. Then even medical doesn't help, you know, to them.
Thank you so much, Dr. Rifat, and no, Dr. Salma, sorry. And Dr. Rifat, what would you say while we take a departing note from you?
Actually, I would say patients should take it serious, and they put themselves for a investigation, so that they treat in a proper way, rather than to go to the malpractices GPs or the, you know, ayahs and people like that, or quacks. So better to go to a fertility specialist, investigate yourself. Most of the time there is no problem, only the reassurance is required. So it's better to investigate rather to be ignorant and just putting blame on yourself and stressed out.
Thank you so much, Dr. Rifat, and thank you, Dr.
Thank you
Salma,
very
for
much.
shedding light on this very important subject. And you heard it, you know, from the gynecologist and the embryologist herself, that it's not the end of the world. If you're not able to conceive a child, there are other options available. You can go ahead, you can approach them instead of, you know, going here and there and spoiling yourself and complicating things before they can actually be sorted. Please refer to a proper, qualified gynecologist and IVF specialist. Thank you so much for joining us. Keep watching. Allah Hafiz.